Hi everyone and welcome back to the series 5 in 5. This is the series where I provide you with key clinical tips in 5 minutes or thereabouts. As always, if you enjoyed the video and gained value from it, then give it a thumbs up and subscribe if you haven't already. Let's get started. In today's video, I'll be talking you through what do you do during an examination. Now this video follows on from an earlier video in which I spoke about what you do before you even touch the patient, before you start an examination. Now, of course, each examination is slightly different. I'm going to be talking about a basic structure here, and of course you can tailor it as you go depending on the examination. Before you do anything, you must always inspect. So of course, as you may know already, there is a general inspection and then more closer inspection. With a general inspection, you'll be looking at things like the surroundings, medications and walking aids. Of course, you should always look at the person, you should always look at the patient. How do they enter the room? Are they walking with a limp? When, of course, they are on the couch, inspect the area that you're going to be examining. So if it's their chest, look at the chest wall, look for any deformities, any scars. Number 2 is palpation, having a feel of the area that you're going to examine. Now, before you touch the patient and you go to examine them, make sure you ask them if they're in any pain at all. You don't want to inflict more pain on the patient if they've come to you complaining of pain. And certainly if they haven't come to you complaining with pain, then you shouldn't cause any pain. Now, if they are in pain, then tailor your examination accordingly. I have spoken about this in a previous video, so I'm not going to mention that here. And make sure you check on the patient throughout the examination. Now, of course, you're going to palpate specific and different areas, so make sure the patient is always aware of where you're feeling and talk to them throughout the examination. Number 3 is percussion. Of course, this is only relevant to certain exams like respiratory and abdominal examinations. Make sure you know how to percuss and make sure you don't percuss in a way that hurts the patient, because that can happen. So just make sure you're aware, make sure you know how to percuss to get a good percussion note, and make sure you know what the percussion note means. So for instance, is the percussion note dull? Is it hyperresonant? Does that mean that there's fluid in the lungs? Does that mean that there's more air? When you percuss, make sure you know the location of where you're percussing and the examination findings for that particular area. And of course, make sure you compare both sides in a respiratory examination, for example. Number 4 is having a listen, auscultation. You may listen to the heart sounds, the lung sounds, and even bowel sounds. Number 5, so I'm going to talk briefly about some other examinations like a musculoskeletal or MSK examination. Usually the method for that exam would be look, so inspect the area, feel, so that would be palpating, move, so move the joint if it's the knee joint, for example, and then function. Test the function of that particular area. So if it's the hand, can they pick up a small object? So that's a very basic overview of what you do during an examination. Like I said, there are many examinations and they all take on different structures and different formats. However, that is a very basic overview of what you should be doing step by step. I'm going to be talking about what you do after an examination, and I think it's also important to talk about how you examine children, because sometimes those examinations take on a completely different form and they do need a bit of tailoring. So stay tuned for that. As always, if you enjoyed the video, then give it a thumbs up and subscribe if you haven't already. I will see you in the next episode.